Forbes Books presents Sustainable Leadership and Disruptive Growth with David Radlow. Transformation for a new and better world. Here's David.
My guest this week is physician turned entrepreneur Dr. Merlynn Carson, the award-winning founder and CEO of Myriddian, a health IT consulting firm that integrates data, healthcare, and workforce solutions for better patient outcomes. Myriddian has grown into a national firm boasting a clientele of Fortune 100 companies and federal and state government agencies. Myriddian is one of the top 40 largest women-owned businesses. Merlynn, welcome to the podcast.
Thanks for having me, David. I'm excited to be here.
Over the last few years, we've seen the trend of physicians pivoting from medicine to entrepreneurship. What did you initially see before anyone else that sparked this outstanding value proposition?
I think that we had two challenges that we saw in medicine, at least when I was entering it. First, we had the Affordable Care Act that came in that put all these pressures on technology and the use of EHR. So we saw a lot of physicians kind of retiring out. There was a group of physicians that left medicine early on, took early retirements just because of the technology aspect of it. And then on the newer physicians, you saw that there was a kind of a disillusionment. And I wrote, actually, when I started medicine, I actually wrote this article on New Physicians Journal. You know, you come in and you have this thought that you're going to kind of save the world, you're going to fix everything. And when you get inside the hospital, you realize how little of patient care is actually involved and how much is involved with paperwork and the bureaucracy around it. There's that aspect of it. So some people left because of that. They were a little disillusioned, such as myself. But then they felt like they could fix the other side. And I think what we're seeing now is there's more opportunities. You saw medicine as a one-track field. But now with a degree in medicine, there's so much more that you can do outside of just clinical medicine. And I think that's the trend that we're seeing, why physicians are leaving entrepreneurship. I mean, you see people running government agencies, you see people running health agencies, you see people running medical device companies or being, on the advisory side. So there are a lot more roadmaps out there that provide physicians with other opportunities that they can come in and fix healthcare.
For those that are new to healthcare and IT, what's the fixable pain point?
Fixable pain point. Well, that's a good question. Listen, first of all, I'm really, really thankful that now we're talking about health IT, right? We started healthcare with technology is still catching up. We're still so far behind in healthcare. But I love that we're starting to integrate technology to it. We're looking at cybersecurity as an issue, and we're seeing all this where, there's leaks of medical records and everything else. And that's because as in healthcare, we haven't paid attention to technology. So I'm loving the new focus we're having in cybersecurity. I love that EHR, as much as EHR takes time, it is great to have a way for us to be able to gather information, for us to be able to build patient profiles, to give access to patients. And that's the big thing that we're working towards, to get a central point of aggregating all of this data that we have. We have so much disparate set of data, and here we are trying to do evidence-based healthcare. And it's hard to do evidence-based healthcare, right? We have a knowledge translation issue. It's hard when there's so much different sets of data and we can't pull everything together, and we expect clinicians to somehow pull research, pull what they know from clinical, pull things from patients, and then make this judgment and have something that we are supposed to deliver the best care. That's impossible. So I think now the focus on healthcare IT and really specifically around data and pulling that data, I think is going to be that big focus. And that's where a lot of companies are focusing on. And that's where my company focuses on. And I think that's what we're going to try to fix. And it needs to be fixed.
Where did you see this as a fast-growing niche of a very large category? What does Myriddian do that is so special that attracts so much growth?
So we are very big into population health. My background is in research and pathology. And what we've done with it is kind of find that integrating clinical medicine, data, technology, and workforce. You can't have one without the other. You have to have a strong subject matter expertise You have to have good technology DevOps to be able to create the solution, integrate. So that's kind of what Myriddian's focus is, the integration between healthcare technology, really bringing that clinical expertise. Because whatever we're developing and whatever we're doing, we want to make sure that it helps the end users, not just, we're talking about providers, payers, we're talking about patients here. One of the spaces that we're very successful in is in the registry space. And what that space does is we pull data from several different sources and we overlay that data, build a profile around it, and we look at what are we seeing in trends. So for instance, cancer is something that we're looking at. What type of cancer are we seeing in certain populations, geographically specific? And when we present that data back to say, we're seeing a prevalence of a specific type of neuroma or a lymphoma or something of that sort, we're providing that information back for let's start funding research into this. Let's fund drug development. So that's the kind of niche that we are working on. So registry space is very big for us. And we've seen that with, a lot of immunizations and things like that. So that's kind of what's really making our company grow. It's the focus around population and public health.
Let's take a step back. You were a receptionist in the staffing industry during medical school. Did it help at all? What lessons learned from there that you could share with us?
Yeah, and when I started my company, I would tell people that never turn down, never think it's just, this job is too low for you. I just, I remember going for that interview and it was a stint. It wasn't something that's supposed to be a long-term thing. I was studying for my boards at that time and I had some time off. It was the holidays and, you're a broke medical student because all the money goes into paying back loans, right? And I remember interviewing and the person told me, you're very overqualified for this position. And I said, I don't, it doesn't matter to me. I just needed a job at that time. And that job kind of led me into, I kind of learned a lot about how the government worked. I learned a lot about how things worked within what a government contractor is. I didn't know that. And to be honest, Dave, it was one of those things that, I thought my career path was just going to be around in medicine. I felt like it opened my eyes to different career paths around. And I tell people, and I've always told people this story about how I started off and how I kickstarted the company based on that experience. We shouldn't turn down a job because we think it's too low. What can we learn from it? And there's always something that we can learn from our experiences. And I value that experience that I had.
If you'd be kind enough to share the amount of your team now, we're just pivoting now from the past. If you care to share, so the listener that doesn't understand this that well can give an idea of the approximate share revenue by category that makes up your business, such as management of projects, healthcare operations, data analytics, and revenue cycle, and workforce solutions and training. So people get an idea when they're listening to this as to what areas that you cover and how meaningful an impact that you have based on either share numbers or other numbers.
That's an interesting question. I don't think, I'll be honest with you. I'm not sure that I have those numbers broken down or in front of me right now, but everything we do, we integrate. Like I said, it's an integration for us. So for instance, when we do training and development, we look at training and development as a case base. We're not looking at it as something we're pulling off the shelf and we're giving you a couple of syllabus and flyers and looking at it. No, this is a case-based approach. And that's how medicine is. It's looking at a case and looking at it from how does this impact your agency? We create these training materials based on how is it relevant to you right now. Let's use relevant materials. We are, as a company, we are over 100 W-2 employees. We're well over 10 million in growth, and we continue to grow. And it is a mix of projects. We are a national firm. A lot of our employees tend to be in the DMV area, but we have people as far as Montana. We service a lot of the government facilities, including Navy, Army, HHS, a lot of HHS agencies that we work with, but we also work with commercial sectors as well. Verizon, for instance, is a client of ours. Just various different things that we do for them, from case management services to training and development. And it might be that some of these overlap within the same agencies or private sectors.
And getting back to, we'd be kind enough to share the importance of data relative to healthcare and workforce solutions, both on patient-centered care clinically as well as other ways that they're used throughout the system?
Yeah, absolutely. I mean, I mentioned before the focus on data, I can't even say how important it is. There's so much data out there, and now that we're trying to figure out, how to utilize that data for better care. Now, when we think about, and I mentioned this earlier, evidence-based, healthcare, it would be great to create repositories where when a physician can go in and say, I have a patient here with a rare disease, and I need to figure out how to treat this patient, versus the patient having the physician having to look up and find out, is there any experimental drugs out there? Is there any experimental research out there? Or how has this been treated? They're physically having to do that research. So pulling data from disparate sources, we can actually pull that together. Now we're giving the power for physicians to be able to look that information up and seeing that, look, maybe Switzerland is doing something different, or somewhere in another part of the country we're doing something different. And that is sorely lacking right now. So we need some sort of a literature-based discovery in healthcare where we actually aggregate a lot of that. And we're working towards it. I think a lot of the text mining techniques are great. So that is where healthcare is going, and that's where data is very, very powerful. It's better to see patient outcomes, and also these registries that we're creating. When we go to legislations, we're looking at where do we find research funding? How do we validate that we need funding for diseases like Hansen's disease which is leprosy? Just rare diseases. How do we focus where the funding goes? And it's based on the data that we have. For us to be not blindsided, we need to be able to focus on where the funding goes by understanding what our population is going, what's happening. So doing some surveillance as well around it. And that's a big focus right now around the government. Surveillance for not just drug adverse reactions, but surveillance around what are we seeing within diseases.
If you'd be kind enough to deviate, and I apologize at times that you'll hear through me the business side of things and then going to the clinical side and the medical side. But if you'd be kind enough to share how you test marketed this concept when you were one person and that you were just starting to incubate and it was going to test market, how were you able to test market that this concept was valid and you saw that there was a business opportunity here?
Well, I'll be honest. I think I got lucky in terms of what the legislative changes we were seeing when I entered the market. It was the Affordable Care Act, and it was a huge impact on the healthcare system. And when the legislation came out, it was, people were still trying to figure out how to get around it, how to fix it. And that's when I was entering the market. So I focused on what was in the healthcare space, what was affecting the healthcare space, what was going to be the most impactful in the healthcare space. And that was the ACA Act. And so I read the legislation and I became sort of a subject matter expertise. I didn't read it was a 1,000-page distilled legislation, but I read the legislation to understand what is in there and how is it going to impact the healthcare market. And my first client was a large healthcare system. I started off in the advisory side on trying to kind of work around their workforce and how do they fix their workforce based on the ACA and how do they stay compliant. And from there is kind of how the company grew. It was within that workforce space, but it was legislation impacting healthcare that caused me to enter the market. And from there, we've kind of built around that client to expand our services. And they're still a client of ours, and we've kind of grown in our different niches from that.
Okay, that gives us an understanding. Now, how were you able to scale your processes and people? It's one thing to provide yourself services, but then you're able to get others to work with you. How did you do it? How are you able to get to where you were then to where you are now and continue to keep up with quality and efficiency and delivery for your clients?
It is transparency, honesty, and just relationship, really. And I'm proud to say, like, I tell a few of our clients this, like, we are in the process of building out our business development arm right now. We didn't have a business development arm when we started off. It was very consultative in nature in terms of how we interacted with our clients, but we were open and transparent. I didn't take on a project that I didn't think we could succeed on. I've made referrals to the client, and that kind of kept them kind of engaged with us. Like, I had one client call me and ask me, they were very interested in doing something with creating a clinic for within their employee organizations. I provided some back and forth feedback around it. Now, the way the process worked was they had to go with different set aside in the government. They have different set asides from like women owned to small businesses and what different set asides. So they had to go the different set asides. I even suggested a few of the companies that I knew in the space that would be good performers around this because they knew that space. So we're very transparent. If there's something that we can't do, we will tell them we can't do it, or if we think that their goals and their timelines don't match, we're very transparent about that. And that relationship and that transparency has helped us grow, and has actually given us we have good performance. The government evaluates us, and it goes on our record. Actually, we have great performance reviews from both our private and our public sector. And it's all been based around that consultative nature, and just being transparent and honest with our clients.
Many of us have seen through COVID-19 the use of digital health and medicine skyrocket with our own personal doctors. What effect did COVID-19 have on your business and for the future?
If there's anything COVID-19, if any good came out of it, it is the fact that, telemedicine has become very popular. And now we can do telehealth visits. Now healthcare and doctor visits are more accessible. So I like that focus has been there. We needed to have that, and goes back to your previous question, David, about healthcare and technology. And these are the kind of things that we need to see in health. Healthcare is behind, and telehealth should have been something that we should have probably had before COVID, but COVID put a focus on it, and now we have those access. So there's a lot of rural areas that didn't have access now that have access to it. With COVID-19, I think the work that we do in the registry space really kind of started picking up a lot more, because our focus has been around population health and public health. There's a focus around it more now. Before, we were doing some surveillance. We had some things that we're looking at, but we weren't looking at it as much as we should. We weren't investing as much as we should in what our population is doing, not just in this country, but across the world, working with the World Health Organization. So the company really kind of helped boost us a little bit more. So COVID-19, really kind of focused in more around the work that we're doing, the importance of the work that we're doing, creating these registries and repositories and building these profiles and understanding the data within geographical locations.
You hear a lot about burnout from folks in medicine, especially in the time of COVID. How do you think entrepreneurship can act as a counterweight in this situation?
As I mentioned before, I think there's a lot of avenues now from just outside of clinical medicine. So I think looking at it as to solve challenges within the clinical medicine space. I hate to say it this way, but there is a lot more opportunities out there than just clinical medicine. And I think that's a challenge, right? We have to balance our workforce because we can't have everybody leaving medicine and we're going to have a supply issue. And we already saw that. But we also have opportunities out there to solve for how do we triage patients better. Maybe we use technology better. So there are other opportunities out there for physicians and nurses and just healthcare practitioners in general.
That's great. Well, hang on, Merlynn. We have to stop right there. But coming up in the second part of my conversation with Dr. Merlynn Carson, the CEO of Myriddian Health and IT, Merlynn shares what drives her to connect with other female entrepreneurs and help them to succeed.
I wish I had more of those mentorship type of when I entered the market that I could have relied on. So I made it a point to say, my company takes off and my company grows to where I want it to be, I want to give back, because there are women out there that should be encouraged to be in this business world, and I want to make sure that I can help foster that. We need more women in business, so that's important to me.
To connect with David, go to davidradlow.com. David's book, Principles of Cartel Disruption, Accelerate and Maximize Performance, is now available wherever books are sold. This has been Sustainable Leadership and Disruptive Growth with David Radlow, a presentation of Forbes Books.